Trichomoniasis is a sexually transmitted infection that affects millions of people worldwide. On this journey, we will explore the mysteries of this disease and its impact on global health. The COVID-19 pandemic has taught us how a virus can spread rapidly and affect everyone's lives if not contained. If you haven't already, there's a video link in the description or card to watch. Similarly, Trichomoniasis has its own origins and consequences. Let's delve into this history. 1. Trichomoniasis, also known as trichomoniasis, is an infection caused by the parasite Trichomonas vaginalis. We will discover how this infection originated in Wuhan, China, and spread throughout the world. And trichomoniasis has a significant global impact on public health, for example. Trichomoniasis is one of the most common sexually transmitted infections worldwide. It is estimated that 276 million people are infected annually. And it has an impact on women's health. In women, the infection can cause vaginal discharge, itching, discomfort, pain during urination, and pain during sex. Trichomoniasis is also associated with complications during pregnancy, such as premature birth and low birth weight babies. An impact on men's health. They generally don't present significant symptoms. The infection is often asymptomatic, but it can be associated with inflammation of the urethra, increased risk of infertility, itching or discomfort in the penis after infection, and pain during sex. And one of the forms of infection occurs, mainly through unprotected sexual intercourse with an infected partner. It can affect both men and women, and transmission can also occur during childbirth from mother to child. And one form of prevention is consistent condom use is crucial to prevent the spread of the disease. People diagnosed with the disease should inform their partners to prevent spread. Trichomoniasis is treatable and curable with antibiotics such as metronidazole, Flagyl, tinidazole, Tindamax, or secnidazole, Solisec, used to treat the infection. All sexual partners should be treated simultaneously to prevent reinfection. Complications such as the infection can facilitate the transmission of other sexually transmitted infections. It appears to increase susceptibility to the human immunodeficiency virus, HIV, which causes AIDS. Without treatment, the infection can persist for months to years. So always remember to seek a healthcare professional if you experience symptoms or suspect an infection. Prevention is key, and consistent condom use helps protect against sexually transmitted diseases. And the disease is so dangerous that there is a World Health Organization, WHO, with objectives to reduce new cases of Trichomoniasis by 50% by 2030. This involves strategies for treatment, diagnosis, prevention, and global education. But even with health organizations having major objectives to help end this disease, there are still people whom the healthcare system is not reaching to help eradicate this disease and other more common diseases. As an example, we have a summarized article from the website sciencelosb.org that will be in the video description with a link to the site. The article discusses the situation of rural families with health issues, and it begins as follows. The urgency to expand knowledge about health conditions, living conditions, and aspirations of rural families, as well as the actions that healthcare professionals are taking to address disease prevention and health promotion, formed the basis of this investigation. It sought to understand what is needed to achieve health from the perspective of the rural population and how professionals can contribute to this process. A qualitative study was conducted with 57 farmers residing in 25 municipalities in the far south of Rio Grande do Sul. Data collection techniques included systematic observation, photographic recording, collection of medicinal plants, and semi-structured interviews. The data revealed that the expectations of rural families regarding the actions of healthcare professionals are seen as establishing health needs in these territories, to obtain a closer relationship with services, and for their lived experiences to be shared, recognized, and valued. The needs are aligned with the construction of spaces for interaction and gathering, where experiences can be shared, serving as support to overcome individual difficulties faced. But in the meantime, vaccines are being developed, and the main candidates for vaccines against S. Mansoni for humans are based on the use of recombinant proteins and are in different phases of clinical trials. And in Brazil, the Vaccine Technology Center at the Federal University of Minas Gerais, in partnership with Fund Ezequiel Dias Foundation, is developing a vaccine. The studies are in the preclinical phase with tests on animals. Preliminary meetings with Anvisa have already taken place. But many obstacles are emerging, such as misinformation. The spread of false or distorted information, especially on social media, is a critical challenge for democracy. Manipulating public opinion through misinformation threatens the stability and proper functioning of society. It's essential to combat misinformation to protect rights, health, the environment, and democracy. Digital education and media criticism are important tools to address this challenge. However, as COVID-19 has taught us several important lessons, trichomoniasis also teaches us several important lessons. Regarding prevention and awareness, prevention is crucial. Using condoms correctly during sex can prevent the spread of the disease. Awareness of sexually transmitted infections is crucial to protect public health. Treatment and cure as well. Trichomoniasis is treatable and curable with medications such as metronidazole or tinidazole. Seeking medical help and following the treatment is essential. Monitoring and research also help greatly. A good example is the World Health Organization, WHO, working to reduce new cases of Trichomoniasis by 50% by 2030. Monitoring antimicrobial resistance and vaccine development are areas of ongoing research. Solidarity and education. We must support and educate adults about sexual health and prevention. Hope for the future lies in global collaboration, scientific research, and ongoing awareness. In summary, Trichomoniasis reminds us of the importance of prevention, treatment, and global cooperation. Together, we can promote health and well-being for all.